Steve Martin from the dementia theme. This is a fairly academic question, so feel free to... Can you put the microphone close to your mouth? Sorry, this is a fairly academic question, so feel free to well, ignore it if you want. Yeah, I mean, at the start, there was a kind of an indication that, you know, when we think through, we oversimplify things because we talk in abstractions and simplifications. And then we listen to some excellent projects that have, you know, changed design or whatever, but essentially you're bringing it back to a HTA, a HEA, you know, the 5 Ps. They're fundamentally abstractions and simplifications of complex systems. So I'm wondering where you feel the value is of, you know, the engineering oversimplification and the health oversimplification, because we're essentially both doing the same thing.
It's a very good question. So mapping is the thing that underpins a lot of what we're trying to do. And when you map things, you are abstracting. And the challenge is to map things in such a way that you abstract the things that are really important in that situation and not lose them. So that's why that project is so key to what we're trying to do. When we try and understand the system, do we capture the things that really matter and somehow dispense with the things that are less relevant? So it's right at the heart of what we're trying to achieve. And we're very aware that whenever we do mapping or modeling in engineering, you are simplifying, but you try and simplify in a way that it enhances your ability to solve the problem rather than obscuring it.
I'm Alex. I'm part of the EDC as well. I just wanted to comment on the question. And I think it's true that it's very difficult to be able to represent reality perfectly. It's even impossible. But I think for me personally, my interest in models is motivated by the fact that we use models all the time. That we use our mental models which inform our decisions. When we have a discussion about A&E, you have a model of A&E in your mind, I do in my mind. And so we base our mental models, we use those as the basis for decision. But when you put the map or the process map, whatever it is, on the board, you can critique that. We can have a discussion around that. So that exposes the assumptions, which you can then share or reject. So for me, just really the fact that we cannot claim to represent reality perfectly, it's just impossible. But the fact is the choice, which models we use. Either we rely on our mental models or proper models, which we can discuss.
And there's a key point there from Alex that when we are modeling, it's not just the model or the language of the model, it's the process of modeling that's just as important to design. I think there's one question at the front here.
Thanks. I have a comment about the last question and then a question for Prof. Clarkson as well. And the comment about the difference between healthcare use of these techniques and engineering use of these techniques is that engineering's use is broader. As somebody who studied both, it's like a playground's worth of tools and techniques that we've never seen in healthcare before. So we really have an opportunity to explore things that we've never seen if we open our eyes and are willing to go outside of our box and look at what's used in other industries. And it's actually what, if you remember, Dolan Hill invented, I suppose you would call it, evidence-based medicine. In 1969, Hill said exactly the same thing. Don't limit yourself to evidence-based medicine. Keep looking in industry. Because he was from industry. And we haven't done that. And we've got to do that if we want to move forward and to explore and create and develop better systems in healthcare. And then I just wanted to say to Prof. Clarkson, do you know what's planned in future in terms of that kind of thing, that creative thinking in the department in future?
For us, it's about integrating these different perspectives. And it's not just about taking engineering methods into healthcare. It's not that at all. It's about us trying to understand the key principles of what we do naturally as engineers and working with clinical teams and clinical service deliverers to understand how we translate those into viable practice within the health and care delivery community. Thank you.
I think on that note, John, we better draw this to a close. Please join me in thanking the EDC team.